And here with answers to your medical questions in our Ask the Doc segment is Dr. Msonthi Levine. Colorectal cancer, this is something that can be prevented if folks get screened.
Yeah, it seems to be the prep that seems to be the biggest issue, and the gastroenterologists are trying to work on doing something that doesn't involve so much liquid, but they have to clean the colon out so that they can view the colon, basically. So that seems to be the biggest complaint that I see. Patients are reluctant to do the test.
But if you don't get the test and you end up with colorectal cancer and you end up dying, I mean, think about the alternative, folks.
I understand, but you know, patients, certainly have their limitations when it comes to that. Their mind is in other places. Unfortunately, sometimes, yes, their health is not their priority. I agree with you; it makes complete sense. But when you think about drinking a lot of liquid, and you think about having to take off, and you have to do the procedure, there's also complications from the procedure potentially. So it's not free of that, and you factor all that in. Sometimes patients just don't want to do it. So it's nice to have this screening test because it does suggest that you might have it. I think that might push people who otherwise wouldn't do it. Now they probably would because there is some suggestion that they might have a malignancy. So it's nice to know that they're working on more and more easy to do screening, simple tests, blood tests.
Just do it in the comforts of your own home.
Absolutely. So I hope that catches traction and that it is implemented, because it would be nice to have, because a lot of people, again, like I say, frown when they hit 50 and I start talking about needing a colonoscopy. They put it off a lot of times again, and I agree they need to get it done.
Keep hoping as we get closer to that age, they keep pushing that number back a little bit further, maybe 55.
I don't think so, because obviously our lifestyle in America is not that good, and it increases our risk of developing cancer. A lot of the processed food that we eat, a lot of the constipation we see, a lot of the medicines we take, that increases inflammatory condition in the colon and increases the risk of colon cancer. And certainly if you have strong family history, then you need to start a lot earlier. So it just depends, but I don't see it going away anytime soon.
All right, on to some of our viewers' medical questions. This person says, what name brand blood testing meter for monitoring blood sugar do you recommend for testing on the arm instead of the finger?
I don't think we're at the point where we are recommending the arm testing. We still like the finger. It's the most accurate at this point. I know I've seen some commercials on TV, but we're still recommending the finger. We don't really have a preference for the brand in terms of the finger testing.
Okay. How many weeks of therapy after a walking cast comes off from ankle surgery do you recommend?
I'm not quite sure. A lot of times the orthopedist or the physician who performed the surgery will have some recommendations. Normally we'll have you see the physical therapist, and they are trained professionals. They will recommend a length of time, so it's not just one way of doing it. It just depends on multiple factors.
Okay. My L4, L5, and S1 nerve roots are damaged. I had a microdiscectomy 3 years ago and the compression has been relieved. However, my pain still increases with activity. Any ideas why I'm still having pain?
Well, she probably still has some areas of degenerative joint disease. They targeted the most significant aspect of that DJD, but she could still have it in other places. And anytime you have surgery, you can have scar tissue and post-surgical pain. Certainly if she's overweight or she's smoking, she needs to work on those factors as well, and possibly some physical therapy or injections would help as well.
All right, we've got lots of other questions. We'll get to those in just a minute, so don't go away. Dr. Levine will answer more of your questions next on Live at 5. We're back with Dr. Msonthi Levine to answer more of your medical questions. A 62-year-old woman has chronic obstructive pulmonary disease from smoking. Is there any cure?
Don't smoke. I think that's the cure.
Will it cure it?
We've talked about that before on the show. I think given time, we're talking about several years of not smoking, you can regain some of your normal lung function, but certainly the damage typically is done. But certainly you talk about a cure, that's fuel adding to the fire. You have to stop smoking. If you do have symptoms, we have a multitude of inhalers and oral medications, oxygen if you need it to help you. But just got to stop smoking.
All right. A 55-year-old woman works in a daycare and now has a really bad cough. Think it's pertussis?
Not necessarily. Pertussis typically has a characteristic whooping cough. That's why we call it that. Sometimes cultures can be done of the throat. I'm not sure if that's typically done in the physician's office. May be able to be done at a hospital setting. Certainly the characteristic cough is what gives it away. So if I didn't hear that, I probably wouldn't naturally think about that. Cough can be from so many other benign things such as drainage or asthma, acid reflux, so I probably wouldn't go for that initially.
Okay. I was told by my doctor I have an overreactive thyroid. Should I be treated for it?
Absolutely. I mean, you know, the body is looking for homeostasis, evenness, so if it's overactive, normally we have to try and look for the cause. In the meantime, there are some medications we can give you orally that will calm the thyroid down while we look for the cause. A lot of times we like to basically burn the thyroid eventually and then place you on thyroid replacement long term. You don't always have to go that route, but that's typically what we recommend.
What are some of the, what are some of the signs of an overactive thyroid?
Weight loss, sweating, nervousness, diarrhea. So, you know, very characteristic.
If she's seeing those signs, then...
Absolutely, but you know, those signs could be from other things. Normally the blood test helps us out a lot, but it's certainly not something you can live with forever.
Right.
At some point, like I say, you're going to suffer the consequences of having an overactive thyroid. And we do see those patients in the hospital. It is not fun. They're very sick. They're almost close to dying. We have to act very rapidly. So most of the time patients will lose weight. They're nervous. They can't sleep. They know something's wrong. And thyroid tests are typically a test that we normally do for most patients. You come in for a general exam, I'm going to check the thyroid because sometimes it can be subtle.
It almost sounds like anxiety in a way.
It can be anxiety. Some people present with anxiety symptoms, palpitations. They've been put on anti-anxiety medications. They've had a huge cardiac workup, and then we just check the thyroid and it's overactive and we get them treated. So overlap of those symptoms, certainly.
All right. Unfortunately, we are out of time and we've got lots of other questions. We'll get to those next week. We appreciate you dropping by. And you can always visit our website and see the answers to these and other medical questions posted online. And if you'd like to have Dr. Levine answer your medical question, you can always mail us at the address listed on your screen, fax us 892-7305, email us at laf@kftm.com, or post those questions every Monday on our KFTM News Facebook page.